Hello, how's it going, guys? This is Dr. Coring at you guys again with another episode of Real Health Talk with Dr. Coring. For those who do not know me, again, my name is Dr. Coring. I am an internist by training and trade, also a pharmacist by training and trade, who is currently in a fellowship learning how to be an oncologist/hematologist. It is my absolute passion and pleasure to discuss various health topics, to educate patients, common folks such as yourself, regarding various health issues, essentially for you guys to live your best life. I take pleasure in that. I take responsibility in that with my patients. I just love educating patients. I feel like educated patients are healthier patients. Therefore, it brings me here today with another episode to discuss vaccines. Which vaccine? Influenza vaccine. Why? Because it's flu season. Let's go, guys. Let's get vaccinated. And I have some real exciting news. Guess what? The FDA has just approved a new influenza vaccine product. What is it? It is a new product that will allow you now to self-administer the influenza vaccine. Yeah, you don't need me. You don't need a pharmacist. You don't need a healthcare provider. You could administer the flu vaccine at home in your pajamas. Yep, that's right. But you have to be at least 2 years old and you can't be older than 49. And there are also some other caveats that affects your eligibility, and that's why I want to discuss this today. So therefore, the topic today is who is ineligible for this new self-administered influenza product. That's what I want to discuss today. All right, so let's get into it. Let's just easily get this out of the way. Who's eligible? Basically, like I said, this is a live attenuated vaccine. What does that mean? That means that it's the actual flu virus that's being administered to you, but it's attenuated, meaning it's the weakened, diluted version of the flu. Therefore, it's really important that you have an intact, healthy immune system because we're actually giving you the flu. However, we expect your immune system to handle it so much so that it's going to give you immunity towards it. Therefore, we need your immune system to work. Therefore, it brings me to my next discussion, which is who is ineligible. So you have to be at least 2. You can't be older than 49 years old. And you also have to have a healthy, intact immune system. So therefore, if you are immunocompromised, you can have this new vaccine. What does immunocompromised mean? That means if you have cancer and also if you have HIV or AIDS, and also if you're taking any medication that can weaken or compromise your immune system, such as steroids and or chemotherapy. So immunocompromised states mainly cancer, or if you have HIV, AIDS, or if you're taking a medication such as chemotherapy or steroids that put you in an immunocompromised state, you're not eligible. Who else is ineligible? If you're pregnant, you're not eligible. Also, if you're in close contacts with people who are immunocompromised, you're not eligible. Also, if you suffer from a chronic disease such as lung disease, such as COPD, and or asthma, you're not eligible. If you're suffering from a chronic disease such as heart disease, congestive heart failure, you're not eligible. Also, if you have a neurological disease such as Parkinson's, multiple sclerosis, cerebral palsy, if you have a history of cochlear implants, you're not eligible. All right, so those are the contraindications. Just to summarize, you're not eligible for this vaccine if you're immunocompromised, meaning if you have cancer, or if you have HIV or AIDS, or if you're on chemotherapy and or steroids. Also, you're not eligible, or this vaccine is contraindicated to you if you're pregnant. If you're around people who are immunocompromised that requires quarantining, you're not eligible. If you have chronic diseases such as COPD, asthma, heart disease, Parkinson's disease, cerebral palsy, multiple sclerosis, have a history of cochlear implants, you're not eligible. How can you access this vaccine? We talked about it briefly. There are a few ways. One way, you could just get a prescription. Have somebody like myself, your physician, write your prescription for this vaccine. You take it to the pharmacy. at the pharmacy. The pharmacist can administer it, or they can package it up and you administer it at home if you're old enough. Meaning, if you're older than 17, younger than 50, you can administer this vaccine yourself. However, if you're a kid, you will need a caregiver and or an adult to administer this vaccine. That's one way, prescription. Another way, you could go online. They do have online third-party pharmacies that are available. Go online. They have a questionnaire for you. You fill out this questionnaire. This questionnaire will then be forwarded to the pharmacy. The pharmacy write a prescription for the vaccine and then fill that same prescription likely at that pharmacy. And then the product would be mailed to you with instructions on how to administer it yourself if you are an adult, and also how to administer it to a kid if you are a caregiver for the child, if the child is eligible. So that's how you access the actual product. Why is it important? We talked about this. Please, guys, get your flu shots, get your flu vaccines, get vaccinated. This is a cool product because it's convenient. There's no excuse if you're eligible. You know, we're really trying to cut down on the flu. Why? Because the flu causes problems. What are the problems? Illnesses, hospitalizations, and death. It can cause a terrible pneumonia, so much so that you can become compromised and you can go into cardiopulmonary arrest because of this. Sepsis because of the flu. We scared of COVID, sure, but the flu caused damage too. All right, guys? Get vaccinated. This is a cool product. It's available now. It's approved. If you're eligible, look into it. Get it prescribed. Go online. You know, gain access to this product. I'm sure the insurance companies are approving it as well. All right. So that's my time, guys. Peace and love. Get your flu shots. Get your flu vaccines. All right. Bye.